Good afternoon. And I think you're all speaking an awful lot of sense because it's an issue that we encounter in our constituency offices every week, nearly every day. Some families coming and their child's on a waiting list for either an assessment, or if they've had the assessment, they're waiting for services. It's got to the stage where I'm from Cavan, where the team now are not even given dates to parents for children to get services, which I think is actually illegal. They're actually saying we can't supply you with a date, and staff are leaving. And I know you've dealt with a lot of the issues around the recruitment problems, the promotion problems, the problems with registration. I'm presuming you're talking about Curo, which is another body that's under-resourced. So I suppose it's just, what my concern are for the children who need those services now. So even if we increase the number of people going into college to take up all of your professions, that's going to take a number of years. I suppose for the first question I'm going to ask, do you think the PDS model could work if it was properly resourced? In other words, if there was better funding and if it was fully staffed. I mean, the model has been on paper since 2014. It was ran out then in over 2020-21. The CD&Ts were set up. It was already taking over teams that had waiting lists. And I know some professionals said to me, I can't see how this is going to make a difference because we have waiting lists, so we're just going to compound our waiting lists. I know you've dealt with lack of leadership and lack of consultation, but I mean, it's just if they could work, or, I mean, is there a role within education maybe? Because I'm looking at the UNCRPD, and inclusive education is one of the articles there. We are not meeting that convention at the moment on inclusive education. Inclusive education is where every child attends their local school, except maybe those with the most profound and complex disabilities. But that's not possible now because schools are not properly resourced. They don't have enough SNAs, they don't have enough teachers, and they need people, I think, from your profession to come in and work within the schools. I know that was happening in some of the special schools prior to the progressive disability model. Then they were withdrawn, they were supposed to be returned. I don't think that has happened, or not in all cases anyway. But I'm just wondering if your opinion of working within schools, is that a good model? I know there's a social inclusion model. It's slightly different to the preschool model at Ames. So I'm just, I'd be interested in your thoughts on all of those, or how best this should all progress, because we are going to have to properly resource our schools, our education system to make sure it's an inclusive educational process for children. Just another issue that has been brought up at the committee on a number of occasions is the rapid prompting method, and I've read your submission on that, and I absolutely respect your professionalism and your analysis. There's just some parents, I suppose, maybe have seen it work for their children, because maybe, I don't know whether they just hadn't access to other models to see if they'd work, or they just haven't worked for their child. But is there any role for it even to allow a child to begin that communication process and then maybe progress? Because I know your concern is maybe that it's not the child or the young person's own communication. It's actually they're being prompted in a certain way. And I'm just wondering, though, is there a role for it even as an initial step to getting on to a better model as such? Thank you.
I suppose the question around PDS, is it working? PDS is based on a child-centred, family-centred approach, and we feel that that's a very good start for a model, and one that we would agree with. But it hasn't been implemented where you can work within that model. I suppose prior to PDS, there were waiting lists. A lot of those waiting lists were not recognised or audited by the HSE. So when PDS happened, a lot more children appeared than kind of had been expected, and this has been shown by numbers in that when the teams reconfigured, the HSE had figures in mind as to how many children would be going to those teams. All the teams had significantly more children on their teams than had been expected. So that, I suppose, there's a planning piece there that, why were they so surprised by the numbers of children who came onto the disability teams? Schools, I suppose, from an occupational therapy perspective, we work with children and families within the setting where they're functioning. So home, school, community, we would work with children in all those settings, and still do. So I suppose this piece around the special school piece is that therapists are working within the special schools at present, not, again, within the numbers that is needed for that. But children who are linked to disability teams have access to the very few staff that are on those teams, whether they're in a special school or in the community, and children are being seen. But again, it's not at a high enough level. So from an occupational therapy perspective, yes, we do agree with occupational therapists in all schools. I think, did you have any other points?
I think in terms of that piece around is progressing disabilities working, I think we would agree that that model that focuses on a child, that takes away access based on a diagnosis, is a good model. The issue is, as you said, it's been happening for so many years and still isn't implemented. Fully hasn't had the policies and the backup with it, hasn't had the funding, and it's, you know, we can have a policy, but if we don't actually implement and audit it, we don't know if it's effective, if it's working, if it's doing what it's meant to be doing. And I think that's the state that we're at in PDS. And to even start auditing it, where we know there are such fundamental issues to the actual setup and rollout of it, is a challenge. So we need to go back and look at what's happening and really target some of those structural issues to the setup of PDS. Because at its heart, at a model that supports a child, we all support that. In terms of RPM, as the ISLT and from the information we submitted to you, you know, we advocate for robust assessment of it and use of AAC for children, and a system that can appropriately support a child and evolve over time with a child, that allows them to access school, home, their community, and that needs to be a really robust assessment, or a robust AAC. It might be a whole variety of AAC that they use. So a child might use some gesture love with family, they might use a device in school, they might have a communication book or board when they're outside. So it's not just one device or one strategy, and it needs to be a system that a child can use in school that can support them to learn language and learn how to communicate and support their communication interactions, but will also help them develop literacy and access education. And we would, from the current evidence base as ISLT and internationally with our colleagues, advocate for other methods of AAC. If there's a small, when we have a restricted budget to do that, there are more effective methods that we would advocate for over RPM.
And just to come in there, just around schools, I suppose we advocate strongly and support strongly the return of speech and language therapists to special schools, but we would be very clear that it shouldn't impact on the resourcing or the service delivery within the CDNTs. And I suppose, again, bringing back the idea of equity, you know, that all children who require SLT services, you know, be it special schools or classes or mainstream, should have access to that service. And I think your point around, we advocate for that rights-based approach, as you said, around Article 24, and I think it's very clear around how to support that inclusive environment. And here in Ireland and internationally, we have a lot of evidence about, and as you named, about different pilots and programmes that have been put in place already. We have the school inclusion model, we have the ABC programme, we have the therapy in school demonstration project, we have SLTs as part of the regional support group for the NCSE. So we have lots of evidence to show the effectiveness and the positive outcomes of having SLTs and occupational therapy in schools and the importance of it in schools. We just need to actually move from pilots and programmes to a national strategic plan again, with timelines and somebody actually following through on them and it not being piecemeal again across the country.
Just to, I suppose, echo a few things that my colleagues have said. In terms of PDS, as you said, it is a lot more, though, than just resourcing. But even to start with resourcing, we would all feel that those mapping exercises that were done didn't get the figures right in terms of for setting up the teams or projecting, because there has been an increase in the need in terms of access to services. But in addition to, I suppose, the resources, we're looking at support for staff, and I think we've all talked about how challenging a work environment it is for therapists. And with PDS, there was a dismantling of some supports for frontline clinicians. That's something that needs to be looked at, particularly if we're trying to attract people back or keep people in post. But also just in terms of what my colleagues have talked about, even in support pathways and access to specialist supports. I think one of the challenges with PDS was in dismantling a number of areas of support. While certainly PDS makes it equitable, you had areas of expertise, and that a lot of that got lost within PDS. I suppose for a lot of staff working on the ground, it feels like there's not those clear pathways or clear policies that certainly would support a PDS and CDNTs in terms of functioning. Again, I'd echo what others are saying around reviewing that, and we need to put families and children at the centre of that.
I suppose, I'm not sure if educational psychologists, are they under the remit of your organisation?
So yes, absolutely. And educational psychologists, sorry, that was your other point around schools. Educational psychologists are in the schools through the NEP service, the National Education Psychological Service. So certainly they are providing supports to school, but in terms of what we're looking at in terms of the EPSAN Act and reviewing of that, there is no doubt if that is to be implemented or realised, that there will need to be additional resources to support a inclusive. Adam Harris speaks very well around it's not just about entry to a building, it's what happens within that building, having a level of support. And I think it needs to be really clear there's no one size fits all here, because we're looking at autism as a spectrum, the diversity within that. It's about supports being individualised and flexible to support people when they need and as they need. So that presents challenges, that there needs to be a range of supports that need to be considered, but certainly accessing clinicians and drawing on clinicians will be important in those settings. And sorry, just to make maybe one further point around the special schools, as you said, there's been a lot of back and forth about who's supporting and how that's supporting. And I suppose that the challenge, and I think for lots of clinicians working in PDS, is that idea of being maybe split into so many pieces. So there's the AON piece, special school piece, all the other pieces that have to do. And I think the assessment and need report I suppose, explained this very clearly by saying, for years services have been underfunding for the most vulnerable in our population, but also expecting that therapists can perform some sort of miracles of the loaves and fishes type, in terms of, the increasing demands and the reduced capacities. So certainly that needs to be something that needs to be looked at. And again, it's not to pit areas against areas, but it is looking at maybe protected resources for areas.
Because I just think there aren't enough NEP psychologists. I think that's an obvious statement. There are some schools who don't have access and they use the SCAPA programme. But then I think, or they seem to think that they're limited to maybe one a year, which one assessment a year, which is not sufficient if you have a number of children in your school that that require assessment, you know, whether it's moving on to secondary school or for other issues as well. So, I mean, it's, again, an area that's under-resourced, and we need more NEP psychologists. And I know the teachers and teachers' unions are concerned about the educational assessment part of the AON process, which has just been highlighted recently, and suddenly they're being told they must provide this. Well, they must provide the information for the NCSE to assess it. So there's a little bit of concern there as well. And again, you know, if it's going to be an increased workload on teachers, an increased workload on NEP psychologists, that needs to be looked at as well and properly resourced, and who should be doing that as well.
Certainly, just to say, we think it will be a good place to start. Educational psychologists at present are not funded. They are working in the education system. They're not funding. So we certainly think in terms of increasing the places and funding, their training will be a step in the right direction.